I have a younger brother who is schizophrenic, and I remember having to kind of navigate that, and as a Black family, us not wanting to see what was wrong with him. We weren't sure whether it was mental illness or where he's just kind of sad or down. He started to isolate himself. This went on for roughly 2 years before we had him hospitalized. And at that moment, I really noticed that the stigma that, mental health carries in the African American community. That's when I realized that I wanted to become a therapist. My name is Anisha Salisbury. I'm a licensed clinical social worker, which means I do one-on-one therapy with individuals, couples, groups, and I also have worked with children in the past as well. It has been so rewarding working with people who look like me, people who I know would be afraid to go see a therapist because they thought maybe that person doesn't understand them. I read an article before that talked about African American people just have this belief that life is supposed to be hard. And so I think that that's why there is such a hard time asking for help. And I'll even go back to slavery. In slavery, we were just supposed to be strong, right? We were supposed to not speak, we were supposed to do. And I think in some way it kind of taught us to silence ourselves. For the last 4.5 years, I've actually been at a mental health clinic in one of the poorest communities in the South Bronx. So being there, I really noticed how poverty affects mental health. And, just housing instability affects mental health. So it's hard to have one-on-one therapy with someone when they're like, Anisha, I don't know where I'm going to eat tonight. Anisha, I don't know where I'm going to sleep tonight. Be Her is a women's run group therapy practice. I provide individual psychotherapy, but we also do groups, and they're called Be Her circles, and it's been very therapeutic for a lot of people. And when I'm not doing just traditional one-on-one therapy, I also provide groups for women. I've done like women empowerment summits before, which is very important. I do a lot of work with the New York City Housing Authority, and I work with a lot of women there, and we kind of do group work and just learning how to communicate. So I think those are things that are very important for not just women, but all people. As far as meeting the needs of African Americans who have mental illness, I think one of the biggest things is just having more representation. So as of late, there has been more and more African American social workers, mental health counselors, psychologists. So I think that that's a huge thing. When I do meet people, they do tell me the importance of being able to see someone who looks like them. And they talk about, we may not have had the same experiences, but there's some things, Anisha, that I just don't have to explain to you. So I just feel more comfortable talking about family dynamics and things of that nature. So I think really it's about representation and just also, again, access. In New York City, they have something called mental health first aid training. So they are training about 250,000 New Yorkers on just how to help their friends, coworkers, family members who are suffering with mental illness. There's more public awareness campaigns. I think it's called Thrive, which has been really great. You see it all over the trains, and they're just letting people know if you have a hard time with your day-to-day functioning, or you feel, or you do actually know that you have a mental illness, there are numbers that you can call, places that you can reach out to. So for me, one of the most important things that I do for myself outside of therapy is that I see a therapist. A lot of what I listen to is trauma. So there is vicarious trauma. So I need to have someone to kind of talk to about all of those thoughts and those feelings and those emotions that I personally have. I can't just listen to people all day and not be able to kind of deal with my own stuff, right? So generally, I would say all therapists should have a therapist. Not all of us do, but I think it's very important. People have to realize that if we're going to go to the doctor and make sure we are physically healthy, we also have to start making sure that we are mentally healthy as well. This is not about me, it's all about you. And I think that's a space that people need more than anything, to just have a space just for them, for someone who is willing to help them. And it's not about being weak, it's not about being strong, it's just knowing that, you know what, I want to be better and I need to do better right now, and I might need a little help doing that. When they come to therapy and we really kind of unpack all of this, it's been really amazing for them, because sometimes they just don't have the safe space to talk about that. And I think that that's one of the big things that therapy does for people. It provides a safe space when you may not have one.